Hello and welcome to our sixth installment of our regional report out call here for the Northwest region of Kansas. We're grateful to have you all with us. We're here at 3:30 live on this YouTube channel every week. Really encourage you to sign up on our website at covid.ks.gov, regional-reports. Let's see here. Megan, if you could make me the presenter, I'll share the screen here. Excuse me real quick here. Okay. So there we go. All right. So this is what that website looks like. You've heard me talk about it, but covid.ks.gov/report-outs. You can put in your email address, select Northwest region or any of the other regions you want to get in, and you'll get this email with the dashboard and everything that we look at each week. You can also look at past dashboards and webinar archives down here at the bottom. So just a great way to sign up and follow these. We'll go through our dashboard this week, and then I'll kick it out to our report outs to see how things are looking on the ground. We also have our friend Dr. Watson back with us this week, talk about transfers, and Paul Harrison from the KDHE talk about testing in the state. Not a lot on vaccines this week, but there'll be more next week would be my guess. So let me go through our dashboard here that you're looking at. Our friends at the Kansas Hospital Association do a great job putting this together for us. You can see, we had been watching staffing shortages. Hey, Megan, you might want to mute yourself. We'd been watching staffing shortages, and because it's
not me, but
oh, I wonder where that's coming from. You can see that's not as big a deal this week. So staffing stuff or space is typically the pinch on hospitals. This is good to see this number coming down. Obviously, more and more people in healthcare getting vaccinated. And then, coming here and comparing this to last week, where we were at, these are numbers you want to see go down. So confirmed or suspected COVID patients that are hospitalized inside this region, we were at 58 last week, down to 48 this week. This had stayed the same. ICU beds with COVID patients, we had 7 last week, 7 this week. And then, here, 13 available ICU beds last week, 14 this week, taking us to 58% capacity availability, which is just really, good news. We're seeing the system unclog. Even better news down here is we're seeing the daily and weekly case count stay lower. We had this peak where we got over 1,000 here in late November, and it stayed high into December, but then it started to come down, and I'm really proud of what Northwest Kansas has been able to do here at 286 this past week. That's just fantastic. And then you can see the percentage of the population in each of these counties that has tested positive for the disease at this point, and then the ICU bed census for the Northwest region. So COVID, non-COVID, and available ICU beds. So generally really good news here. Also just going to flip over while I have the screen. We talked about this website last week when Seth Conkle was with us, but kansasvaccine.gov, if you click on vaccine data right here on this page, you can see what's going on with the vaccine rollout across the state. And I think these numbers will be really interesting to you as the weeks roll on here. This number lags a little bit here. So I know we're over 125,000 at this point of people vaccinated. And then these numbers show up as soon as they start rolling towards Kansas. But you can see we've gotten 3.5% of the population at least vaccinated. You see first dose versus second dose, a breakdown of Pfizer versus Moderna. Pfizer had a week head start going out. And then you can see how many are going out here on a daily basis. And a lot of this just has to do when we get supply. We push all that supply out, wait for the next week, get supply, push all that supply out. And supply will really be what's dictating kind of our future around vaccines here. So just a good window here. If you go to kansasvaccine.gov vaccine data. And we'll have that link on the email that comes out to you guys. Looks like we don't have anybody here from public health today. And so I know they're really focused on vaccine and what will happen. Let me just give you a little heads up on this. So we're thinking in the next week or so that the state will make the decision to move from phase 1 to phase 2. Phase 1 was healthcare workers and long-term care facilities. Phase 2, a much larger population, right? Anybody over 65 or in congregate settings and critical workers, I think, that are, have a lot of interface with the public. Each county is going to make a decision how they prioritize and roll that vaccine through. And so the counties are waiting for a little more information from the state, but I would really encourage you to pay attention to your local county health department. They're going to give you an idea where to sign up and how to go and what it will look like. The thing to remember is that there's going to be a lot of people that want this vaccine. And like I said, the phase 2 is a large population. For instance, I'm here in Wichita, it's 150,000 people or something like that. And we may only get 2,000 to 5,000 doses a week that come in. And so it will take a while to work through that. And so we're just going to have to show some patience. And I know as the feds are able to get more to Kansas, our people at our county health departments and all our partners stand ready to get that in arms as fast as possible. So that's what to be paying attention to this week. As they get more information from the state, then the counties will roll that information out to you, what your county's plan is to help drive that vaccination effort. Now, let me pass it over to Reagan just to give an update from the hospital side of things.
Hi, everybody. I hope everybody's having a great week. Some good news on our end for our Hayes campus. As many of you know, we've kind of been hovering in anywhere from the upper 20s, maybe a little bit into the 30s, to the lower 20s. We're down in the teens. So we are at 17 inpatient right now.
That's COVID patients.
Yes, saying. COVID patients. So thank you for clarifying. Also, I should always introduce myself, Reagan Cusmanio, Director of Governmental Affairs for the University of Kansas Health System. So that's a good number. Definitely seeing the decline. We were on a call earlier today with Dr. Norman. He also presented to a joint committee of Senate Public Health and Welfare, as well as House Health and Human Services today. And John, I don't know if you guys have access, but I know he specifically mentioned that the Kansas vaccine website that is up and running within the next few days, a full map of Kansas will be present. And maybe you covered this, I had a little difficulty getting on. Will be available, and you'll be able to go onto that map and hover over your county, and information will be included there around who is providing vaccinations in phase 2. And if they are willing to provide the information, they will embed it, which will provide contact information on how to get in touch with that entity so that you can find out more about vaccines in your area.
Thank you, Reagan. That's good news. Good news out of public health and hospitals this week, really across the state. And Dr. Watson from Cheyenne Mountain Software and the Mission Control app, which is helping with the transfer of patients across the state, can give us an update from there too. Dr. Watson, let me make you the presenter here, and you can unmute yourself and show us the way. Here you go, my friend.
Great. Well, thanks. And yeah, we're seeing a capacity coming back in most of the hospitals across the state. We still, Wichita area was lagging behind, but Kansas City area opening up nicely, and secondary receivers across the state were looking better as well. So really happy about just everybody having a little bit more room. It certainly makes it easier for transport. Northwest Kansas has led the way on sort of decline, and that's not changed at all. We're still seeing certainly the numbers that are there. About 30% of those are COVID positive. About 30% are looking for placement for patients. So still very similar as to before, but just the overall numbers are less, and the trajectory is good. We're really on a downward trajectory. So I think it's a testament to the state in and of itself, what it's doing, but also population centers that are smaller and that were socially distancing by nature. We're ahead of those who were denser and more urban. So congratulations, Northwest leads the state in kind of the decline.
Like that. That's good news. All right. Now let's pass it over to Paul Harrison from KDHE to give us an update. And if you can make him the presenter, Dr. Watson, he's going to share us an update on what's going on with the testing strategy across the state. And you're muted, Paul.
Technology, what are you going to do? Yeah, so I'm Paul Harrison. I'm the Deputy Director at the State Public Health Laboratory. I just wanted to get on here and give everyone kind of an overview of the Kansas testing strategy and where we've been and where we're going. I'll try and make it quick. I assume everyone can see my screen. So this is the topics I'll touch on today, is what role testing plays in the response. Where can you find the testing site? How we're evolving this strategy to move forward as the vaccines get rolled out and the different kinds of regions of Kansas we have to think about and how we serve them, and then where do we need kind of engagement from the community to help us out with this effort. So here, I mean, really what we're looking to do is, of course, reduce the spread. That's what testing is all about. I mean, I've heard lots of people say that, as the vaccine gets rolled out, testing kind of becomes less important, and I just don't think that's the case. We're going to continue to deal with COVID for a while, and what we really need to do is keep testing elevated so we can identify cases and make sure when those cases come up that we have the tools to isolate that and keep it isolated so it reduce the spread to people who haven't gotten the vaccine yet. Of course, we're always focused on protecting people that are mostly at risk. So, we have a system set up to test long-term care facilities. And we really are focused on trying to return people to work and school. We're constantly working with K through 12 and we have a system set up for private industry to apply to get testing so that we can help out that side of Kansas as well. Move along here. So this here is a map of where testing kind of is right now in the state of Kansas. So these green dots represent mass collection sites where we have set up tents or what have you for people to run up, and they can either walk up and get tested, or they can schedule ahead of time and come get tested. Those red dots are people we've partnered with across the state. We call them community testing partners, and they could be anything from pharmacies to FQHCs to hospitals or local health departments. It can be a number of things. I'll talk more about that in a minute. And the yellow dots are public health departments that are doing testing. You'll notice a couple of mobile testing units in the state right now. And that's also getting ready to expand because our lab at KHEL has actually bought and modified some vehicles to turn them into mobile testing units that we plan on deploying across the state. Oh, and now if you want to get tested, on the right here is where you would go for those mass testing sites. That's gogettested.com/Kansas, and you'll be taken to this map where you can find a spot to book that's close to you. All right, so as we look forward and how we think about the landscape of Kansas and what we want to do and how we can help out the most, really what we're looking for is to kind of expand these community testing partners and also partner with local health departments. So we have lots of ways to do that. If you know of anyone that's interested in becoming a community testing partner, they can reach out to us and we'd love to get them set up. I'll have the contact information here in a minute. But really that's how we're going to drive this, especially like in Northwest Kansas where it's more rural. That's kind of the only way to really, get to everybody because it's so spread out. So we really need that engagement. The mobile units will play a little bit of help there. And we have also partnered with a lab to do mail-in saliva kits that we can set in a local health department, and someone can show up take the kit, and then just gets mailed right back to that laboratory.
Yeah, and Paul, we heard on the last call from Ellsworth County that they had really good experience with that with you guys, and that the residents really liked it, and people didn't like getting their nose swabbed too, as a part of it. So good feedback on that, and really good pivot. Sorry to interrupt you.
No. Yeah, we realized that nasopharyngeal swab is not the most comfortable, and so we are definitely looking for other ways to use testing. And so that includes using nasal mid-turbinates as well as saliva, and anything we can really do to make that experience more palatable, for the citizens of Kansas. Another thing we're doing really to try and help improve is get the results back faster. So some of these bigger vendors, when we brought them on, there was a bit of an issue with that. And what we've done is we've worked with Kansas Labs to integrate them into the Well Health program. And so basically it doesn't take a day to travel to a different state. We keep the business in Kansas, and these labs are good. I mean, I'm telling you, they're a 24-hour turnaround, almost every time. So the results are getting out faster. And that's really how you control the spread and control the pandemic, is getting the results as soon as you can, so you know what to do and who to do to and with. So that's key. And we also have acquired quite a bit of rapid antigen tests that we're looking to supply out to different areas of the state for kind of surveillance stuff. That's still kind of a work in progress, but we have secured those now. And then this last one, just ensuring more coverage by having those mobile units available to go to hit a hot spot, if we know an outbreak's happening, or to get into an at-risk community who maybe cannot get to where the testing sites are. So we see that quite a bit across the state, where people might know where a site is, but they have no way to get there. So we got to get it to them. All right, so what we really want is, from anyone who might be on this call, is engagement. And so we would like to partner with you. If you feel like you have the desire or the need for this, we would definitely like to be working with you to expand testing across the state of Kansas. We certainly need your feedback for any areas where we could improve. And that goes for anything. And really just keep on encouraging everyone to go get tested, and maybe don't even just do it as you get symptoms. Just do it as a regular thing to make sure that you're staying on top of it, and we're doing the best for our community. And of course, encourage the vaccination in your communities. That's going to be vitally important as we move forward. So I know I've taken up probably more time than I should have at this point, but if you want contact information, this is where you can go. So KDHE has a call center that's open every day of the week, except barring some holidays. You can always reach out to your local health department. They also know how to get a hold of us. If you have anything that involves the state lab, KHEL, this general email address, you can email out and we'll get you any support you need. And then if you have any kind of questions or concerns with any of the big well health testing sites, this is the hotline that's set up for anything in that realm. And that's what I got.
Great, thank you very much. Anything anybody'd like to add to what Paul had to say? And Paul, do you mind making me the host again? Yeah, I'll do that. Anyway, thank you guys very much for being on here. Reagan, do you have anything you wanted to add, Dr. Watson? Okay. Really the way this thing's laying out is we're seeing trend numbers move in the right direction in Kansas, but it'll be a race between getting this vaccination out and when this more contagious variant that we're seeing in different places in the world and starting to take shape in some parts of our country. Most scientists believe that it's probably already in Kansas, just a matter of time before it might become the dominant variant. And so it's a time to continue mitigation efforts and a time to continue testing and to stay on top of it while, we race to get the vaccine into arms. And so be paying attention to your public health department this week. and everything going on there. And really appreciate everybody's time in the presentations today. It is again regional. Let's see if I can get it right. covid.ks.gov/report-outs to sign up to get the emails for these. But we'll be back 3:30 next Tuesday to hear what's going on in Northwest Kansas. Hopefully have a little more information on vaccine for you. Wishing you all well, and I hope you have a great week. Thanks very much.